Here at VCU, we have a breadth of experiences that makes our program a premier program for surgical training. Given the sheer volume of patients and cases, each resident performs cases appropriate for their own level. Our main location is downtown at VCU, but we also have the opportunity to rotate at St. Mary's for community pediatric surgery, the VA, where they have a busy general, oncology, and vascular service, and Winchester, which is in Northern Virginia and provides a unique experience of community general surgery.
The educational directive of the General Surgery Residency program is to prepare our residents for all aspects of current and future surgical care. The objective is achieved through a variety of educational endeavors. Weekly grand rounds and morbidity and mortality conferences allow for new innovations and critical review of cases to be discussed. We also have weekly didactic teaching programs based off of the standard Scientific American curriculum. These sessions are resident-led with faculty moderators who specialize in the topic being presented. There's also a state-of-the-art simulation center where we're able to practice our laparoscopic and endoscopic skills and achieve our FLS and FES certification. The program provides access to TrueLearn questions and for senior residents provides CSAP. Overall, there's a strong educational focus of our program, which we are striving to improve continuously.
I can tell you a little bit about critical care. We take care of the sickest of the sick. We take care of surgical critical care, trauma critical care, burn. We have the largest experience in surgeon-performed ultrasound, and we're so excited to have you here to give you all the opportunities for training and make sure that you develop that niche that will make you different than anybody else that comes to a surgical residency.
The trauma and acute care surgical services at VCU are both clinically busy and diverse services. We treat common general surgery conditions from inguinal hernias to appendicitis, complex peristoma and abdominal wall reconstructions. The same is true for our trauma service, as we're a level 1 trauma center that manages both motor vehicle collisions to penetrating injuries from gunshots or stab wounds and everything in between, often taking a lot of referrals from outside hospitals that are too complex for them to care for. This really allows residents to really get a good job at critically thinking, diagnosing, and treating sick patients. My favorite part of these services, though, is the operative experience. On the trauma service, you'll have a good share of penetrating injuries, so you'll be able to do laparotomies, thoracotomies. There's never a dull moment with the amount of complex surgery we're doing, if it's trauma or general surgery. And the services prepare you well for fellowship and future practice.
We see general surgery residents in almost every year of their training, and you'll learn something new every year that you're with us. We see patients with complex colorectal disease, including inflammatory bowel disease, colon and rectal cancer, anal cancer, pelvic floor disorders, and anal rectal disease. While on our service, you will work with us in the inpatient surgery setting where we perform a wide range of open, laparoscopic, and robotic cases. In addition, you will join us in the outpatient surgery center where we do most of our anal rectal surgeries. You will also rotate with us in endoscopy where you will learn to perform colonoscopies. General surgery training is very complementary with colon and rectal surgery. You'll learn to do laparoscopic colectomies, be comfortable in the pelvis, and operate on the anus and rectum. We look forward to having you on our service.
VCU lets you do research between your PGY2 and PGY3 years. It's optional, so you can choose to do a 5-year program instead of 7. We have several options for research. We have a basic science option, and we have a quality improvement tract. The quality improvement tract allows for a research resident to help out with projects in the hospital, working closely with several departments to optimize patient care. We also have a global health research resident who travels to Rwanda and helps develop improvements in their medical care. Regardless of what you do, we've historically had a good track record of being productive, meaning published in the laboratory, and even if you don't take time off. The added bonus of research time is that it allows you to teach or mentor medical students if that's one of your passions.
I was interested in lab to begin with, and I looked into it starting my intern year. Can say that Dr. Anand is very supportive, and he'll meet with you regularly to make sure you get what you want. Currently in Dr. Mangino's lab, I never had to worry about funding since he has a very well-established lab with a lot of money. All I needed to do was to express interest. I'm currently working on low-volume resuscitation therapy on septic shock models. I work mainly on rats and pigs. We do legitimate surgeries on these animals. I also do clinical research with Dr. Lanning. He's very productive, publishing lots of papers. He's also very fun to work with, which makes it that much better. We're currently developing a URAS protocol for pediatric patients. All that to say, I've had a great experience with research so far. There are great opportunities here if you're interested. Previous residents have done really well wherever they went, and I'm hoping to continue that tradition.
As residents here at VCU, we've expanded our surgical training to reach beyond our downtown MCV campus to include rotations in Winchester, Virginia. While in Winchester, we work alongside community surgeons in private practice general surgery, acute care and trauma surgery, and surgical oncology. We work one-on-one with our attendings in an apprenticeship-based model. This gives us an opportunity to focus our time in the operating room and to develop our technical skills. While in Winchester, we get more exposure to bread and butter general surgery, and we get a taste of private practice surgery outside of a large academic center.
We offer comprehensive training in all aspects of surgery, with clinical rotations in all specialties, including vascular surgery and endovascular surgery, transplantation, trauma and surgical intensive care, urology, plastic surgery, advanced GI surgery that includes foregut and colon and rectal surgery, and diagnostic and therapeutic upper and lower endoscopy. Not only that, you will rotate in thoracic surgery, surgical oncology, among others. However, and importantly, we also offer community-based rotations. So you will not only learn about the practice of surgery in a quaternary medical center like ours, but also in a private practice setting. I can tell you that I and all the faculty at VCU are dedicated to help you become a caring, skillful, and thoughtful surgeon.
Global surgery is very important to VCU Department of Surgery. In fact, we've created a program for global surgery to bring together interested residents, fellows, students, and our faculty to find ways to collaborate and work together on global partnerships. Our faculty have many collaborations in many countries, including Rwanda, Ecuador, Ethiopia, Haiti, and Jamaica. The American College of Surgeons actually selected VCU as one of the founding partners to collaborate with in Ethiopia.
Through our program, we created short-term and long-term tracks for trainees to learn more about the field of global surgery and have mentorship by one or more of our faculty. As a surgery resident, there are also plenty of opportunities here locally. We have a monthly global surgery seminar series of speakers from around the region who've worked around the world. You can also have the opportunity to work on multiple ongoing projects in a variety of different places. Come and join us and read more about the work that our residents have done on our website.
Many of you have already spent some of your training time at a veterans hospital, but as the saying goes, if you've seen one VA, you've seen one VA. So I'd like to tell you a little bit about our VA here in Richmond. Housed in a 1.2 million square foot, 400 bed facility, we are one of the largest and most complex VAs in the country. In addition to a new cancer center, simulation center, and surgical endoscopy unit, we offer complex surgical care spanning 12 surgical specialties. Our cardiac surgeons perform LVADs and heart transplants on site. Our urologists and general surgeons have been offering robotic surgical techniques for almost 20 years now. And we've recently opened programs in surgical gynecology and bariatric surgery to serve our rapidly growing patient base. Though attending surgeons are physically present to supervise all operative procedures and clinic consultations, we strive to give you as much autonomy as possible in order to hone your clinical decision-making, teaching, and leadership skills.
The Transplant Program at VCU has a strong history that dates all the way back to 1957, when we completed the first organ transplant in Virginia and established one of the nation's first programs in solid organ transplantation. We perform heart, liver, kidney, pancreas, and islet cell auto transplants on a regular basis. And last year we celebrated over 5,000 transplants performed since the program's conceivement. Among the different modern techniques and innovation offered to our patients, we offer minimally invasive robotic surgery to both kidney donor and recipient patients, as well as living donor liver transplantation. While rotating on the transplant service, residents have the opportunity to participate in donor operations, many of our 75 to 100 liver transplants, over 200 kidney transplants per year, and dialysis access cases. We also participate in the pre- and post-operative care of the transplant patients and are exposed to a variety of complex medical conditions.
I am biased, but I think our pediatric surgery rotation is truly unique. We have 7 full-time pediatric surgeons who practice the full gambit of quaternary level pediatric surgical care. Our pediatric surgery group is the only one in Central Virginia, meaning that every pediatric surgery case in our catchment area is done by our surgeons and thus by you. On my recent rotation as the pediatric surgery chief, I participated in every major case from CDH repairs while on ECMO to Nissen fundoplications, Wilms tumor resections, and anal rectal pull-throughs. This is truly an amazing opportunity to experience pediatric surgery at a fellowship level, but as a resident. VCU is continuing to invest heavily with a recent groundbreaking of a $350 million plus facility that will be a standalone pediatric hospital. This will be completed in 2022. Lastly, if you're interested in pursuing a pediatric surgery as a future career choice, we have an excellent track record of obtaining pediatric surgery fellowship matches.
The surgical oncology experience at VCU is pretty comprehensive. The operative experience covers all the major systems throughout the 5 years. First years typically operate on the soft tissue masses, skin neoplasms, and breast cases. When you rotate again as a third year, you're in charge of the consult service and assist in all of the neck cases. That includes thyroid, parathyroid, and the soft tissue masses of the neck. During your chief year, you run the primary service, and the experience shifts largely to the abdominal solid tumors. So that includes things like primary gastric tumors, biliary tumors, and pancreatic masses. We're also one of the few centers in the country that does HIPEC with cytoreduction, which you'll see and participate in at every level. Finally, there's also the great experience on the Winchester rotation, where the third and fourth years spend 2 to 3 months with the surgical oncology group there. It's great because you're the only resident on the service and get to pick and choose which cases you want to see. Our residents graduate, no matter what specialty they end up going into, with a very broad exposure to surgical oncology.
We have a phenomenal program here to grow as a confident surgeon and as a strong individual. Our faculty is interested in you as a person and are approachable with any concerns. They understand residency is very challenging, physically, mentally, and emotionally. We're fortunate to have a fun and supportive team of residents, and we regularly go out for dinner to catch up on life. And this includes everyone from chiefs to interns, spouses, kids, and friends. We celebrate birthdays, weddings, and anniversaries as an entire department. If you have a loss in your family or are welcoming a new baby, we coordinate that time off you need to recover and to be with your loved ones. There's childcare available with hours that agree with our busy schedule, and many of our residents and attendings take their kids there. We make sure that you get the time off you need to make sure you get to your health appointments to keep you at your healthiest. If you need mental health support, we find the resources you need. No stigmas attached. We have also created a committee for the development, engagement, and wellness of our entire surgical department to focus on promoting well-being. At VCU, you will work in a cooperative and inclusive environment to become a strong and resilient surgeon.
As someone who's not originally from Virginia, I can tell you that Richmond is a great place to live. There are so many different options on living locations. It could be in apartment buildings, converted hotels, old renovated tobacco factories, or historic Victorian homes. You can live in the downtown area and have the advantage of being able to walk to work, which is a fantastic advantage when you've had long nights at the hospital. The other options is that you can live in the surrounding communities of Church Hill, the Fan, the Museum District, or Shockoe Bottom. Lots of different options. And when you're in the city, Richmond has really become quite the foodie town. You'll find all over the city different farm-to-table options where the menus change as the ingredients change, and it always makes an excellent culinary experience. And Richmond has very close proximity to the Chesapeake, so we have some great seafood in our city. You're looking for any kind of cultural activities, we have theaters, we have museums, and it's just an excellent opportunity to see traveling Broadway shows, the Richmond Symphony, the Richmond Ballet, or any kind of musical concert, or even traveling up towards DC and having easy access to big outdoor concert events. Looking for some kind of outdoor activities, the surrounding communities, or even in the downtown area, we have the River City. So you have the James River, you could be kayaking, you could be stand-up paddleboarding, you could be white river rafting. Or you could do what I do, which is run along the trails, the islands, Belle Isle, Browns Island, up and down bridges, just an amazing place to live.
Thanks for watching. And there you have it, VCU Surgery, a phenomenal place to train, grow, and live.